G'day and welcome back to the channel. So in today's video, I want to show you how to fix tight groins. And the way that I want to structure this video is the first half of the video is going to go through 3 really helpful exercises to remove tight groins. There's going to be one which is a general groin muscle stretch. The second one's going to be a capsular stretch to target some of the dysfunction associated with tight groins. The third one's going to be an exercise that hopes to remove any of those fascial restrictions in the area. So after doing those 3 exercises, I'm hopeful that your groins will feel really loose and free and a lot happier. But the second half of the video is the important half of the video. So please hang around to see that. But what we're going to touch on is we're going to touch on 2 of the main reasons that I find clinically that your groins have tightened up in the first place. So it goes without saying that if you're not working on these 2 features, or at least ticking them off and making sure that they're working really well, then it's unrealistic to expect that your tight groins will stay loose forever. They will keep coming back because they're being asked to come back for a very specific reason. So getting into it, obviously, when we're looking at groin muscle stretches, there's a few different exercises that we can pull to really bias that groin. The traditional one is obviously just your basic groin stretch. But what I like to do here is I like to do a variation of that where, again, it's not overly groundbreaking, but there's a few technical things that we want to work on with your legs out straight. So what I'll get you to do here is try and be up nice and tall and just get your legs as far out as you feel comfortable. Now, if you can only get a certain distance, it doesn't matter because we're going to work on improving that as we go. But if you find that it's hard to keep your back straight in this position, consider sitting on a pillow or a cushion just to elevate your hips up a little bit. It'll decrease the demands on your hips while you're doing this and make it easier for you to find a groin muscle related stretch. But what I want you to do in this position is have your legs out as far as you feel comfortable. I want you to have your toes and feet bent back and pointing upwards. It's easier to have your toes pointing forwards. I want to roll those legs back as far as possible to increase the tension that's going to go through those adductor muscles. And what I want you to do here is drawing your belly in so that you're up nice and tall with your belly drawn in. All I want you to do is hinge forward from your hips. So it doesn't matter how far your hands and your back and your chest go. All we care about is how far those hips bend. So for me, I'm fortunate enough that if I cheat, I can get relatively close to getting my chest on the ground. That's often seen as a mark of being good at this stretch, but it's not. It's hard to see what's bending because your back might be doing the motion as opposed to your hips. If I stay up nice and tall with my quads and glutes squeezed, my feet pointing up, if I come forward as far as I can before my back starts to bend, this is as far as I feel comfortable going, but I feel a really powerful stretch through these adductor muscles. Now, what I want you to do in this position is I don't want you to just hold this position. What I want you to do is wherever you feel that tightness, try and tense that up. So that might mean that you have to push your heels into the ground a little bit. You might have to dig your heels into the ground and gently push forward a little bit to really bias that. What you can also do is you can push out with your hands. Once you've found a good position for yourself with everything tensed, you can gently push back into your hands to really force those groin muscles to activate and release. So this is a contract, relax, or a PNF, Proprioceptive Neuromuscular Facilitation stretch. What it does is it gets your brain and nervous system active, where when you tense a tight muscle at the end of its range for 5 to 10 seconds, when you release that tension, you should feel that you can actually go further than you could before. So for me, this is as far as I feel comfortable going right now. If I squeeze everything, tense everything up for about 5 to 10 seconds, my right side feels a little bit tighter here. Then when I relax, I can actually drop down further again. Obviously, I can cheat by bending with my chest and through my back, but again, that's not the point. So once you've done that, you should automatically feel like those groins are a little bit looser than what they were before. So that's a fantastic way to do this. Now, from a capsular perspective, sometimes one of the reasons why groin muscles get tight, or at least the movement or the abduction movement, you can be tight in the capsule, right in the deep aspect of the hip. So by using a power band, and I'll leave a link in the description if you want to pick one up, we can do this in 2 different ways. But what I'm going to get you to do here is I'm going to get you to place this right up into that groin area. So make sure that it's not too tender. I want to have the leg out straight as far as I feel comfortable. Again, it's a similar position essentially, except instead of sitting down in this position, I'm going to be on my hands and knees. But what you'll find is as you poke your bottom back towards the band and lean forwards, you can play around with where you feel that tightness. And having the band on the hip, it does pull that hip back posteriorly. It's more of a glide, puts the hip in a better position, and will allow you to stretch the front of this hip a little bit more. Now, this doesn't necessarily bias the front of that capsule. It's going to bias more towards the back potentially, but it's a really nice way to get an excessively tight stretch or a really powerful stretch to those groins. If we want to open up the groin or the capsule at the front of the hip or in the corner of that hip, we actually need to turn around and go the other way. The reason being is that as that hip comes out into an abducted position, as the leg comes out, that ball and socket joint has to glide in the other direction to maintain that congruency. So if your leg's coming back, that ball and socket joint has to shift forwards to maintain that. So we can improve the ability for it to glide forwards by having the bands into the back of that hip, but pulling forwards. So same position again. This time the band's going to be pulling forwards. So again, it's the same shape. Just find a position or a version of this that feels comfortable for you. But what you'll find immediately is you'll get this different feeling of tightness and restriction in that sort of groin area. Now, this may not necessarily be a muscular stretch. It may be more of a pressure. But same thing, you can drop down through your hips, not so much through your back, through your hips. You can shift around, see where the best version of that stretch is. Obviously, maintaining the foot being up. Don't let it sort of roll forwards. Try and roll everything back in more of an externally rotated position. It'll open up that groin a little bit more. And then press into the corners that you feel are needed the most. Stay here for 30 seconds, a minute, 2 minutes, whatever you feel most comfortable with. And again, as soon as you've done that, you should automatically feel like those groin areas, or that groin is a lot looser than what it was before. So in terms of freeing up tight groins, the hip capsule stretch and just a general PNF related groin muscle stretch is a really powerful way to free up a lot of that restricted tissue. Now, the third aspect of this is we want to see if we can find anything else that's restricted there. It may become adhered or it may be moving as smoothly as it could. And we can go hunting with a foam roller or a medium-sized ball. And all we want to get you to do here is we're going to get you onto your belly and we're going to place the roller just next to you. We're going to get it right up into that groin. So, as you know on the channel, I'm not a huge fan of just rolling backwards and forwards. For the purposes of this exercise, it might be useful just to see what you can find. Spend a little bit of time on the roller. You can shift up and down if you don't mind looking creepy for a little bit, just to shear some of that tissue free. But another great way to do this is you can bend and straighten your leg or your knee and really shear free some of this tissue. The other thing that you can do here is if you, again, don't mind looking creepy, you can do an anterior and a posterior pelvic tilt just to try and bias and sort of shear free some of that sort of muscular tightness. Again, I wouldn't recommend doing this in public. You will look creepy. But with those techniques, whether it be a subtle rolling or a shearing or an active release technique where you're moving the tissue around, you'll be able to find a lot of that sort of hidden soft tissue restriction that a muscular stretch and a capsular stretch just don't hit. So again, you can work all the way up from the very top right into that groin area. Go looking for anything that feels tight and restricted. And then obviously a lot of these groin muscles do attach down lower. So just don't forget that foam roller might need to go down towards your knee a little bit just to see if there are any sort of restricted areas in here that can also need a little bit of TLC. So I find sort of in this area here is a little bit tight for me. Nothing horrible, but just make sure you do what you can do to free that up as well. So with those three exercises together, or variations of those exercises, you should very quickly feel like those groin muscles are releasing quite quickly. Now, obviously, gluteal strength is really important just to make sure that you're reinforcing good hip function as a whole. But the conversation that I want to turn to relatively quickly now is what I'm finding to be the cause of that groin muscle tightness in the first place. Because again, if you're not taking the time to solve the cause of your groin muscle tightness, it's going to keep coming back. It's not going to have permission to release long term. And what I want to talk about basically is the two main things that I need you to tick off is how stiff or loose your hip joint is and how functional your low back is. So what I find clinically is that if you have some low back dysfunction, the base of your rib cage or a little bit below, that's where a lot of the nerves come from, the actual nerve roots that form a lot of the nerves that supply your groin, but also the dermatomes that connect to that area, which can cause some dysfunction and it can cause some reactive muscular tightness. And if your hip is also stiff and tight, you can then ask those groin muscles to become dysfunctional as well. So if you're just stretching your groin muscles and just mobilizing the groin, even if you're adding strength to the hip, if you're not addressing some of that hidden low back dysfunction or even some of that hidden hip joint stiffness, then it's hard to realistically expect this to disappear forever. So the first thing that we're going to go through is we're going to go through the hip joints restriction first. So if you did the capsular stretch from before, we can use the same band. We're going to do it a little bit differently. So this time, what we want to get you to do, and we've done this on the channel before, is we're going to have the band all the way up here. We're going to do the banded hip capsule stretch. So ideally, we would get you sort of lateral to the band, but I'll just do it on a bit of an angle just for the purposes of the video here. So what we're going to get you to do is in a neutral position. Again, we don't want you to dump forwards at all. If you have your opposite leg going back, all we want you to do here is keeping your shoulders and your hips together. We're going to gently shift your body just a few centimeters or a few inches to the side that you're trying to stretch. And again, remember that the band is ideally pulling laterally. It's not necessarily going straight back as it is in this video, but we want to get you to shift your hips across back towards the band. What you'll hopefully find is a little bit of subtle pressure in that sort of lateral aspect of the hip. This is some of the, I guess, a part of the hip that gets really tight and stiff from all the sitting we tend to do. It decreases the amount of space and the freedom that that hip joint has. It can cause a lot of impingements. It can cause a lot of groin-related problems because if you have some hip dysfunction, that can come out as groin dysfunction. So if you have tight groins and you're not taking the time to free up your hip joint, that deep hip joint capsule, you're potentially missing the bigger picture in a lot of cases. So at the very least, it's important you try this to see how your groins feel afterwards, just so that you know exactly how powerful or how connected or not connected this is to your dysfunction. So again, shifting the body weight across, it's only subtle. Just want to get you to hang out here again for 60 seconds, a minute, 2 minutes, whatever you feel comfortable with. Once you've done that, we then want to bias more of an externally rotated position. So if you rotate that leg underneath, drop your other leg down just to block it. Again, the band's still pulling laterally. So again, we want to shift across this time, same way that we did before. This time, instead of feeling it at the side of the hip, you might feel it more towards the back pocket. This is going to bias more of that external rotation, which again is a corner of our hip range that we need to have. So again, you can oscillate in and out of that range if you want to, or you can just hang out here based on how you feel. But again, make sure you're feeling that sort of really nice pressure. It's different to a muscle stretch. It'll be more of a subtle pressure. Once you've done that for a minute or two, then we're going to bias internal rotation. Now, this one is potentially the most important for groin-related issues. Like if hip rotation, or internal rotation specifically, is really closely linked to a lot of groin dysfunction. So what we want to get you to do, again, keeping everything straight, rotating your leg outwards this time, not far enough that you feel like you hike your hip up, but just far enough so that at the end of your range, dig that heel in. Again, the band's pulling laterally here. We want to shift our weight across to that side. Now, if you do feel some groin-related pain or discomfort, then just come out of that a little bit further. So don't go deep into that hip flexion. Be a little bit more relative extension, then shift across. You'll feel a really nice pressure, not at the side, not at the back, but a little bit more towards the front. It will feel comfortable. If it feels jammy and painful, again, come out of that position a little bit more. We still want to shift our hips across towards the band, but you don't have to be as deep into that hip flex position if you don't want to. So by removing some of those restrictions in that deep hip joint capsule, again, that hip will move a lot better, and it may take away one of the main reasons for why those groin muscles are being asked to be tight in the first place. So again, if you're someone who's had constant groin tears, groin issues, maybe you've got osteitis pubis or something like that, this is a must do at the very least to tick it off, just to make sure that it's not a piece of the puzzle, because it's often missed and it's relatively hidden and covert. So if you're not looking for it, you won't find it. So that's point number one. So the second thing that I wanted to talk about is potentially even more obscure and more sort of missed than hip joint capsular stiffness, and that's low back dysfunction. So there's a section of your back, as I mentioned before, just underneath that sort of base of the rib cage, the top of that lumbar spine, that has a lot of really strong neural connections to your groin muscles. And if your lower back has become stiff, it's become tight, it's become rusty, it's become a little bit weak, it's become dysfunctional for whatever reason, then anything that's associated with that area, and in this case can be the nerves and the neural connections to the groin, you can get this wave of dysfunction that causes other things around that to compensate. So again, if you're not looking at your lower back, whether there's pain there or not, there may not be. In a lot of cases, there aren't. But if you're not looking for the low back dysfunction and trying to get rid of it, then again, you're not necessarily solving the reason why those groin muscles are tight in the first place. So the way that I like to do this, grab a foam roller. We're going to get you to lie down on your back. So again, the area that we're looking for is not sort of the middle of your back, but the base of that rib cage. And within about maybe a hand's width of that, we want to be looking for some areas that feel stiff, tight, and restricted. It may feel tender, it may not. We need to disassociate ourselves from this idea that something has to be painful for it to be dysfunctional. There's a whole bunch of stuff that is dysfunctional without pain. It's just either not at that stage yet or we'll never get to that stage, but there's a handbrake on there somewhere. So what I'd like you to do, you can have your hands behind your neck. You can rest down on a pillow if you want to. It doesn't matter how you do this, but just move the roller up and down until you feel that there's a segment of your back that feels a bit restricted, where it doesn't feel like it sinks in very well. Maybe it feels a bit tougher. And then what I want you to do is just roll to one side gently and then roll to the other side gently. So not all the way over, but instead of being sort of straight on the roller, just roll over a fraction just to bias the joints on that side, and then roll over to the other side to bias the joints on that side. Take special note of which side feels the hardest, which side feels like it sinks in easier, which side maybe is more tender than the other. We want to spend the most time on the side that feels the most restricted. So if you have all of your groin tightness on one side or one side's tighter than the other, that doesn't always correlate to the same side being a problem, because one of the main things that, again, we try and get across in the channel is that your body doesn't think of you as one body part or a left and a right. So if I have some restriction in my low back on this right-hand side, it genuinely pulls slack or creates dysfunction from above, from the other side, from the opposite side, from below. Doesn't matter where that dysfunction is. If there is dysfunction there, then we need to remove that dysfunction if we want everything around it to function normally. So again, if I'm bound up here and tight here and I keep ripping my shirt on this side because it's over tensioned, I can keep repairing that as much as possible. But until I take away that original restriction, the whole area can't function normally. So even if one groin is tighter than the other, just double check which part of your back is more restricted than the other so that you can take away the root cause of everything. So again, just to get back into this position, start sort of just underneath your rib cage. Again, roll over it, find the side that feels the most stiff and restricted for you. And then all I want you to do here is just take a couple of deep breaths in and then relax. So deep breath in, just pause for a second, and then relax. And again, if you want to emphasize this position, you can, but just find a position that lets you dig into that stiffness. Once you've had enough, once you feel like it's freed up a little bit, then just move it down a fraction and keep repeating that process all the way down to the base of your spine and then up a little bit higher just to make sure that you're not missing anything important. So with that being said, I really want to reinforce that if you have tight groins and you're not checking out the state of your hip mobility and you're not looking at your lower back for any clues as to why that might be happening, you may genuinely be missing the point. And one of the problems with the industry at the moment is that we give you a bunch of strength and mobility exercises to work on, and we don't necessarily give you a way out of that. It's sort of like we just have to keep doing this until you stop doing it, or you have to keep doing it until your pain or tightness goes away. But then as soon as it comes back again, you have to start those exercises again. So we create this dependence on exercises to keep us in a good state, as opposed to understanding that our body's supposed to be in a good state just by default. So if you feel like something's overly tight, something's overly weak, something's not functioning really well, there has to be a genuine reason for that. And again, in this instance, we need to shine a really strong light, get the magnifying glass out on the hip joint and also the low back as well, just that we're not missing some of those potential covert and hidden causes. So if you found that useful, please let me know in the comments down below. What sort of groin-related function have you been dealing with? Are you dealing with groin strains, groin tears? Do you have OP? Do you just have general groin tightness? Are you somebody who's trying to do the splits better, or you just want to function better? Let me know down below. I'm always interested to know. But again, leave a like down below if you found this useful. Subscribe if you're new, but otherwise we'll see you in the next one.